Sometimes the caregiver has to care for a very sick patient, such as patients with severe diagnoses like severe shortness of breath, severe congestive heart failure, patients with bed sores, severe pain. The patient's unable to move. That makes them very hard to take care of, especially quadriplegic patients. The secret is teamwork. The caregiver needs to document what the baseline mental status is and what the major problems are. Frequently, they have to talk with the LVN or the RN nurse. For example, does the patient talk and walk? Are they having fever or vomiting? Do they have severe shortness of breath? Do they have skin wounds? You need to communicate this better in writing to the next caregiver coming on the next shift. The sicker the patient, the more involved is the higher level nursing like LVN or RNs. But still, nurses' aides will be involved with patient turning and changing diapers and comforting the patient. Sometimes the caregiver has more time to console, talk with, and comfort the sick elderly person more than the RN or the LVN. It's critical that the caregiver nurse aide works closely with upper level nurses to have better teamwork. Lifting the patient is a critical issue, and I recommend to caregivers turn the patient every 2 hours, and this is especially difficult to lift the patient from the bed to a wheelchair. This may require 3 caregivers, and back injuries are very common when lifting patients, so caregivers need to ask for help, and supervisors need to have criteria of when the caregivers should use other 2 or 3 caregivers to help move the patient. The caregiver should know how to respond to distress of the patient, either breathing or pain or more confusion. When in doubt, the caregiver should call the supervisor or the nurse. Very sick patients have tubes, oxygen in the nose, IVs in the arms, Foley catheters, so you need to be extra careful when you're turning or lifting those patients to not dislodge the tubes. If a skin wound is spotted, the caregiver must notify the nurse, and many times special ways to lift and turn the patient is necessary, especially if the patient has large wounds. Do not hesitate to ask the nurse questions. Better to ask ahead of time than wait for a crisis or a fall or sudden deterioration of the medical condition of the patient. Learning how to evaluate pain is also important. You can ask the patient, but if not able to respond, report the pain to the nurse. This is a big concern to the family, so the pain needs to be addressed quickly. The caregiver needs to be always aware of the falling risk and prevent falls under all conditions before you move the patient. The risk of falls should be assessed and how to prevent falls in the future. Thank you for listening to this. Remember, love is more important than penicillin.